supposed to know what is around of the hip and what is in gluteal region. Which kind of nerves, which kind of muscles we do expect here. So let me show you this specimen. That's our hip bone, you can see it, right? That's our pubic symphysis, that's our midsection, right? What is the name of this bone? Here. Ilium. Ilium bone, exactly. What is the name of muscle which is right over here? Iliacus muscle, good. What is the name of this muscle which runs from vertebral column transverse processes? Psoas major, and together they form the iliac psoas muscle. And this muscle we can find in the region of the side. Anterior side, exactly. So below inguinal ligament we named it iliac psoas muscle, and it inserts where? It inserts here in vessel trochanter. So if this muscle covered the hip joint, so in contraction the mean action, that is a flexion in the hip. What another muscles we can find medial side here? Any idea what is the name of this muscle? That's our primary muscle of our interest. Take a look. Which bone here on section? Sacrum. Exactly. And on the tip here it is a coccyx, right? So sacrum and coccyx. And the muscle starts from lateral part of the sacrum. It moves, disappears from pelvis. And here, if I will open this region, I can see that muscle inserts into the greater trochanter of the femur. So what's the name of this muscle? Piriformis, exactly. That's our key muscle for our pelvic region, piriformis. What is the function of that muscle? Exactly. While this muscle will contract, it will rotate the femur in hip joint lateral side. So lateral rotation, in other words speaking, what kind of movement is? For the upper limb, how do we name it? Lateral rotation. Supination, exactly. So lateral rotation, that's the same as supination. Agree? Agree. Now, what is this structure which runs together on top of piriformis? Yellow in color. Nerve. That is the main nerve to innervate the lower limb. What's the name of that nerve?
Sciatic nerve.
Absolutely. That's our, can you see it here from this side? That's the sciatic nerve. Sciatic nerve begins on the same place as piriformis muscle, so that is the major nerve of the sacral plexus, and it runs along the back of the free lower limb. Now, you can tell me right now that if some kind of injury is coming to the piriformis, or if we can injure the sciatic nerve in pelvic region, what do we expect to have? That will be the pain along sciatic nerve. Means that is a descending pain in posterior side of the lower limb. What is the term for such a pain?
Sciatica.
Sciatica, exactly. So if we do expect the injury of piriformis muscle and sciatic nerve over here, we do expect sciatica. Now, let's discuss in which situations it is possible. Situation number 1. That's your patient. What is the name, by the way, of this muscle, which I put in place? Gluteus maximus muscle. That's the shape of our buttocks, right? So for what we usually use this muscle? To do what? No, not for the, I'm not asking about action of muscle. I'm asking about our clinical procedures. Yes, absolutely. intramuscular injections we are doing here using the gluteal maximus muscle, right? Now, which side usually we prefer to do that injections? Upper lateral quadrant. So each gluteal maximus, each side, we can divide into the 4 quadrants, and we use the upper lateral one. In case that will be displacement of our injection, we can injure sciatic nerve underneath. So that's the first situation when we can injure it. That's an proper place for intramuscular injection. So when the patient will feel sciatica, means descending pain along the sciatic nerve, backside of the lower limb, right? Second situation, what else is possible? Now I will show another situation. That's your patient. That's a sitting position in the car, for example. And that's a crushing car resident. He or she bumped the car in front. And that's a blow in flexed knee, right? The head of hip will move where? Backward. Exactly. And will fracture the posterior inferior side of acetabulum. And right behind here, that's a place of sciatic nerve. Agree? Agree. So, posterior dislocation of the head of femur from the acetabula, that will lead to the same side, the sciatic. Okay? Okay. Next situation. What else is possible?
Would that only be in a seated position, or is that a general?
That's a sitting position.
Okay.
That's usual mechanism. That's usual mechanism of some car accident, which blow is coming from front in flexed knee and femur displaced back from acetabulum, posterior dislocation. Agree? Agree. So next situation. Again, that's our patient. And we just mentioned that sciatic nerve leaves the pelvis just below the piriformis muscle through the infrapiriformis foramen. Sometimes some fibers of sciatic nerve, they pass not below but through the piriformis muscle. Sometimes it could happen. So now just imagine that our patient with such arrangement of fibers of sciatic nerve, he is doing hard exertion of piriformis muscle. It's happening when someone is climbing mountains, for example, or something else. So he exercised with the piriformis, and piriformis fibers just compress the fibers of sciatic nerve. So at the same time, he could feel the sciatica. That's the third situation. It's like piriformis syndrome. So piriformis muscle contracts some fibers of sciatic nerve. And last situation. Tell me please, what is here on section? What part of vertebra column? This lumbar vertebra. In between lumbar vertebra, these structures, which are white in color, what are they? Intervertebral discs. So, in case your patient has a herniation of intervertebral disc, usually it's posterior lateral hernia in intervertebral disc, this hernia might compress the beginning, the roots of sciatic nerve. And we have same story. We have the pain downstairs, downstream of sciatic nerve. That's the same sciatica.